Of all the radiotherapy planning scans, the head and neck seems to attract the most concern. Some of the patients going through treatment have agreed to share their experiences with you in the hope that it'll help calm any nerves. And no one could have been more nervous than David.
I'm not sure how far I'll get. I'm not sure I'll last a minute on the table this morning. You know, it may be I just have to withdraw. I mean, I'd hate to with this tumour. I'd hate to have to say I can't face it because there seems to be no alternative treatment. So I'm going to try and do what I can.
The best thing as well for me is getting it started. Once they gave me a date, probably building up to the date is probably a little bit worse than what it actually is.
I've had cancer in the head, skin cancer. I've had 2 operations, surgery in a couple of places on the head, but the cancer has spread from the top of the head down to the side of my face, and there's a lot of reservations about any further surgery. So I think it's best to see if they can shrink the tumour via the radiotherapy.
David is here for his final check before treatment starts, but for Jeffrey, the process is just beginning.
So we're going to make a mask that you wear for the duration of your treatment.
This is all about helping the team to plan your treatment. Their job is to avoid the healthy bits of you while hitting your cancer cells hard with high-energy X-rays. The damaged cancer cells find it difficult to repair themselves, while the healthy ones usually recover. If you can keep your head in the same position each time you have treatment, you'll have the best chance of treating your cancer and minimising the effect on the rest of your body. Some cancers can be cured, and some cancers will be controlled this way.
This is an example of a patient. This region here is the spinal cord, so we don't want to treat, and it's next to the higher dose region of where we want to treat.
This goes into a bath of hot water, okay, so it goes all soft and pliable, and then we stretch it. Once you're laying down and you're comfortable, we stretch it over your face to mould to your shape. Okay, then we scan you wearing this mask, and we draw some marks on it as well, so you don't have to have anything drawn on your skin.
This would be an image of the patient. Radiation beams will come from 7 different angles.
So it is a bit wet and messy, so we do need your top things off, and we also need your shoes off.
Shoes?
All right, yeah.
Okay.
The head and neck region is a very movable region, and if we've got a cancer that's at the back of the throat, we need that to be in exactly the same place every time we turn the machine on. So immobilisation is key.
I knew about the mask and the treatment, but it's a question of, that's the theory, now I've got to go through the actual works.
Many people say that they do get used to wearing the mask. Hang on to that thought, and maybe think of something else in your life that you were worried about and got used to in the end.
There we go, yeah. What we're going to do first is line you up on the bed, okay, make sure you're nice and straight.
We treat hundreds of people in radiotherapy head and neck masks every year. This is your first time, but this is something that the radiographers do on a daily basis, and the only way that this treatment works is if you're relaxed. So although it sounds strange, we are actually aiming to make you comfortable when you're in the radiotherapy mask.
Okay. The purpose of this is to stop you slipping down the bed, okay, so that you're really nice and still. Happy?
Yeah.
We put this in the water bath for 2.5 minutes, then they become pliable, then we can then put it on the patient. We tend to leave it on for about 15 minutes.
All right, close your eyes there. We're just stretching it down.
That's good.
We're just going to mould it around your face a little.
I could breathe through my nose, but I didn't know if I could breathe. You know, I wanted to sigh, but you can. If I was going to panic, the only time is when that first goes on, because it's very tight to the face, and then it relaxes.
How are you doing? You okay?
Good.
It'll start to cool down now quite quickly. We're just going to get the cold mitts.
These act like ice pack.
You're doing really well.
I was asked to keep my eyes closed when this went on, but I kept them closed and I didn't realise I could open them. So yeah, you can see everything. And I would imagine This is a harder bit than having the treatment.
Okay, we'll just pop in the markers on the mask now, and then we'll be ready to go outside and scan you, okay? But we're watching you all the time on the cameras, and also there is a microphone in the machine that you can call out if you need us. Okay?
The radiographers are excellent in coaching patients through the whole technique, and they'll be with you all the time and making sure you know what you need to do, and just raising a hand will be able to bring the radiographer straight back in to take the mask off if that's needed.
I was asked if I'm in trouble, give a wave, but I'm sure if I had have done, everything would have stopped. I felt comfortable everybody was here.
What Helen is doing at the moment is scanning from the brain down to the level that we've selected.
He needs another 10 minutes for the mask to set, and then we finished. So we send it now through to physics for the planning to be done. As far as the patient's concerned, they're finished.
So that's your face now.
It's a handsome devil.
Next up is David, who's still not sure that he can go through with it. His mask's been made already. This is his last check, what they call verification, before going for treatment.
You okay?
I think for a minute.
Okay.
You'll be
We'll start
fine.
raising the bed and bringing you under the machine, okay?
Okay.
And then we'll fit the mask when you're in the right position then.
Okay, right.
So it's going to come close to you, but it's not going to touch you at any point, okay?
Over the course of the years that I've been doing this job, I've seen some people just breeze through it, no problem whatsoever. Other people really struggle. And if they do struggle, then there's techniques that we can use, relaxation techniques that can help them get through the process.
So if you pop your hands down by your sides, if that's comfortable.
And relax the shoulders.
We're watching you the whole time, and we are really with you on this journey. And if at any point you are struggling, you just need to raise your hand, any point ever, and we can rush straight in, get the shell off, talk you through it, calm you down, make sure you're comfortable, and then try again.
You just relax and just breathe normally, swallow normally, okay? When the mask goes on, if you let us know, it does need to be quite a snug fit for it to obviously stop you moving.
Yes.
But if it's too tight, then we can adjust it, okay?
Okay.
You have to be comfortable.
Okay.
All right, so we'll pop it on now. Take our time, okay? Pop your chin up into it. That's it. Well done.
We end up doing a little tattoo, which is going to be permanent though, but just the size of a freckle, very little. That will help them to set you up correctly.
Are you okay if I just do this little scratch now?
Yes,
Tattoo?
okay.
Just a little bit of ink under the skin, okay? There we are.
On this screen is where the planning scan that's been taken in the radiotherapy mask has come to my planning system. So I'll know exactly where the cancer was. This is what I want to make sure we get the radiation dose into. I'll then expand that by 1 centimetre or so, depends on the case, to make sure that I'm covering any microscopic disease that we can't see on the scan. And then add on a small margin for the small amount of movement that inevitably does happen, even though you're inside this radiotherapy mask.
You deserve an award.
I got to lie so still because I know, to hit the target must be very, very, very difficult.
Yes.
I think if it's out
And it's where they
by
want
minute measurement, the tumours still be there.
Yeah.
For us, this is an everyday thing, but for you, this is brand new, and it can be quite a scary experience. But we want you to feel that you can trust us to do a good job and get you through the treatment.
I just closed my eyes and sort of dozed off, and next thing you know, it's finished. If there's anything wrong at all, you just lift your hand and they switch it straight off and they come straight in.
I very much hope that you're going to be much less anxious having viewed these films, that you'll know what you're coming to. When you arrive on the day, everything is as you expect, and that the scan itself will be smooth and quick and straightforward and without any difficulty.
And I hope that's helped you understand the process. And if you have any questions, do talk to your radiotherapy team. Good luck.